So this is a follow-up to a reel that I posted a couple days ago and got a lot of feedback on. The lady with the extremely valgus knees, flat feet that had already failed physical therapy because they did a terrible job of assessing her and tried to make her fit the picture in the book. So one of the comments that I had on there was from a physical therapist that looks to have maybe 1 to 2 years experience. And his comment was, well, if you paid attention in biomechanics class and neuro class, you're not saying anything different than what we learned in school. Okay, great. So you must have had a fantastic PT school that actually taught biomechanics in conjunction with neuromuscular physiology and anatomy and exercise prescription progression. So you have probably the only school in the country that did that. So I took a look at this person's account, which anytime somebody makes a comment on one of my posts, I just take a look and see what their background is so I know who I'm talking to. And this guy teaches manual therapy certification courses for manipulation and massage, and also is like 5-level dry needling certified, which tells me that he doesn't know what he's talking about when it comes to biomechanics, neuromuscular physiology, really anything clinically. So we have somebody who went through the conventional thought process, was ingrained in that thought process through his schooling, probably got indoctrinated into cupping and needling and functional exercise and manipulation and all that junk by some kind of guru that he thought was awesome when he was young and impressionable, and bought into that full speed, ready to go. So now he can't unwind his thinking to see what I'm talking about, because what I'm talking about is actually the opposite of what he says he knows. So here's what you have to be aware of as you are watching my videos. I'm talking from a different point of view than what you were taught, or from the point of view that you were taught from in your undergrad, in your grad school, in your clinicals. So when I'm talking about doing certain things, I'm talking about applying the science that you all learned in school, but you never learned how to apply. So I'm telling you how to put these things together in a different fashion. So the fashion that you were taught in school was, hey, here's all the things that you need to memorize to pass this course in physiology. And then next semester, hey, here's all the things that you need to pass this course in biomechanics. And in a different semester, here's all the things that you need to memorize to pass this course in anatomy. But you never were taught how those things fit together and go together in the clinic when you're actually working with a live patient. And then in school, you went and did your lab breakouts where you pretended to, to treat people that had certain ailments and problems and symptoms. And then that's what you took into your clinical world, and you went into your clinical rotations with therapists that went through the same broken system that only can ingrain the same broken things that you were taught and still not teach you how to apply any of that stuff. So I'm talking about things from a completely different point of view. I don't care about symptoms. I don't care about pain. I don't care about swelling. I don't care about anything except what you can and can't do on a functional level and what the root cause of your limitations are. So when I'm talking about assessing somebody with a functional screen that only takes 1 minute to get through, this is a gross assessment. I'm not spending a half an hour breaking down gait, because you could definitely do that. You could watch somebody walk forwards and backwards and side to side and do all that stuff for a half an hour and catch little things here and there. The problem is school didn't teach you how that relates to neuromuscular physiology, which is the point that I'm trying to make. So if you go through functional screen, if you watch people move, if you watch them exercise, and you see things that are wrong and you try to correct that with more exercise, you just lost, because you cannot correct. First of all, you can't even tell what muscles are working and not working by watching a gross assessment. I've been doing this for 23 years, and I watch somebody walk, I watch somebody squat, I watch them move their arms. I cannot guarantee you when I watch them move that even though they have compensations and they lack range of motion, they complain about pain, I cannot guarantee which muscles are inhibited. That's why I have to take every patient and put them on the table and prove what I think I saw in the functional screen, because people are going to compensate faster than your eyes are going to see when you're watching a gross screen. That's why a screen is only the very beginning of what you should be doing. If you watch somebody in a screen and you listen to them talk about symptoms and you go directly to treatment, you just lost. You did not apply anything related to neuromuscular physiology. So understand that if you have not gone through the shift, and I'm saying things that kind of sound weird, and then you justify that by saying, well, I think what he means is this, which is what your experience in your previous history led you to believe, which is incorrect because you weren't taught to think the way that you need to think in order to get to root cause and reverse that. So as you're watching videos, understand that I'm thinking a completely different way than you're thinking. So when I teach my courses and I have students ask questions, I have to revert to the way I thought 20 years ago because that's where the question is coming from. So if I answered the question without reversing my thinking to having the same thought process that you have, I would answer the question incorrectly because I'm using my inferences from where I've been for the last 20 years, which is not where you have come from. You've come from the broken conventional thinking medical model. And in order for me to answer your questions, I need to revert to that, to put myself in your shoes and to use your point of view so I can give you a quality answer. So what you need to do is try to use quality thinking as you're watching videos and understand that you haven't gone through the shift. You don't know how to implement critical thinking standards. You don't know how to get to the root cause. You were not taught how to apply neuromuscular physiology. You think you were. But what happens as soon as people come to lab weekend and I start showing them what's going on and they come to immersion day and they watch me treat patients, they go, oh shit, this isn't anything that I thought it was going to be. Because that's the way you were told to think and programmed to think. Once you get immersed in lab weekend and if you do immersion day with me and you watch me treat patients, that's when all of those layers of incorrect and partially correct thinking will start to peel away and you finally get down to the aspects of critical thinking and root cause that you need to get to in order to move forward. So, long story short, if you're reading my post and it's a 1-minute reel or a 90-second reel, you are getting this much information about this much information. And there's no way with your training and your thought process that you're going to get down to thinking the same way I think until you go through the shift and reverse your thinking. So this is reason number 378, why, if you really want to change your career and if you really want to be an expert and you really want to do something that is game-changing, unique, and get you immediate results with any kind of patient that walks in the door, you need to join the shift. And until you do that, you're still going to guess and get partial information and be living in the broken medical model with no way to get out.